Guys, welcome back to Eco-Freak YouTube channel. This is the next video of parasitology video series that explain morphology, symptoms, treatment and control methods of protozoan and helminth parasites. For more videos, please subscribe my channel. Entamoeba histolytica. So there are two stages in their life cycle like earlier, trophozoite stage and the cyst stage. If we move to the cyst stage in the Entamoeba histolytica, they are round shaped, normal having 15 micrometer diameter. And they are having 4 nuclei. Here you can see 4 nuclei. And having the chromatids. This is the morphology of the cyst. Trophozoite stage, they are having only one nucleus. They are having the food vacuoles and ingested bacteria. Especially, they are having the ingested red blood cells of the host. They are going to ingest the red blood cells of the host. So inside the trophozoite, we can see the ingested red blood cell. This is the morphology of the trophozoite and this is the morphology of the cyst. This Entamoeba histolytica is well-recognized pathogenic amoeba associated with the intestinal and the extra-intestinal infections. Later, we will see what is meant by intestinal and the extra-intestinal diseases. So, they can cause the disease known as amoebic dysentery and they are endoparasites. And the infective stage is the cyst. The transmission can be by fecal contaminated food, water or by hands. If we move to the life cycle, then this is the host. If he passed the fecal matter that having the cyst and the trophozoite stage, if this cyst contaminated the food that we are going to eat, and if we eat that contaminated food with the Entamoeba histolytica cyst, then we can get the disease. After we ingest this cyst in our intestine area, they can produce the trophozoite. So normally, this one cyst can produce 8 trophozoites because they're having 4 nuclei and they can do the division and can produce 8 trophozoite stages here. So in the small intestine area, we can see the trophozoites and they can pass to this area, the large intestine area, and they can infect the large intestine area. This is known as the intestinal infection. They are going to infect the small intestine as well as the large intestine of the host. So we are telling that as intestinal infection. Then they infect the large intestine area. This trophozoite can pass through this mucosa of the large intestine area and they can go to our bloodstream. They can mix with our blood and they can move to the liver and can form the amoebic liver abscess. Amoebic liver abscess. When they are infecting the large intestine area, at that time we can call that as the amoebic colitis because they are infecting especially the colon area of the large intestine. Because of that, we are telling that as amoebic colitis. But if they infect the liver through the blood, then we can tell that as amoebic liver abscess. Okay. So after they infect the liver, they can infect the diaphragm as well as the lungs of the human. If they infect the lung areas of the human, then we can get the symptoms like cough and the difficulty in the breathing. As well as these Entamoeba histolytica can infect the brain region also. So if these Entamoeba histolytica infect the liver, lungs, as well as the brain region, at that time we can call that as extra-intestinal infection. So in the colon region, after they produce the trophozoite stage, in the colon region they can form the cyst by the NC station. So by the NC station, this trophozoite can produce the cyst, and the cyst can pass outside the body by the fecal matter, and they can infect the other host. This is the life cycle. Other risk factors for severe amoebiasis. For the amoebic dysentery, the alcoholism, cancer, malnutrition, older or younger age, pregnancy, suppressed immune system can cause severe infection symptoms. Severe abdominal pain, diarrhea, fatigue, and the rectal pain, because I told you mainly they are infecting the colon area, and unintentional weight loss because they are taking nutrition from us, and bloody stool and vomiting. We can see the mucus as well as blood in the fecal matter, and we can observe the vomiting also. So for the diagnostic stage is the trophozoites and the cyst. For the diagnosis, we can do the stool examination, immunodiagnosis by the ELISA test, antibody detection, and the antigen detection by the PCR. These are the diagnostic tests that we can do for the identification of the disease. Then for the treatment, we can use the metronidazole, tinidazole, paromomycin, and the iodoquinone. And for the prevention and control, so if we practice the sanitation practices and if we maintain good hygienic conditions, then we can prevent from the disease.